used. This is the overview of my talk. We'll talk a little bit of introduction. I'm going to describe the transgrade technique that we are currently using, and we are going through some of number of studies, and all this study led to the work that we are currently doing and upcoming phantom limb pain study. So spinal cord stimulation, we've been using now 55 years since the first spinal cord stimulation done. And it's evidence-based based. It is working very well. It's easy technique and help a lot of our patients. But there are shortcomings, one of which is the target area is not on the spot. So for focal neuropathic pain, SCS, it can be not effective, especially when it comes to the foot pain, ilioinguinal area, or pelvic pain, or even for the back pain. So, and that's the issues that we are facing. So there we were really desperate to find a new target to stimulate and enhance the outcome of this neuropathic pain condition. So DRG, it became a legitimate target, and we were, not long time ago, we thought it is just merely afferent cell fibers and metabolic storage. But now it became clear it play major fundamental role in maintaining a chronic pain condition.